Hello, I am Aisha McDonald, and welcome to a very special edition of From the Guts, powered by Debbie's Dream Foundation. It is Black History Month, y'all. And this is a time where we, as a Black community, as the Black diaspora, are able to honor our legacy and our resilience. But today, we are here to talk about a reality that is oftentimes left out of the conversation. And this is regarding the disproportionate impact that stomach cancer has had on our Black community. Now, the statistics are dry, but the stories are anything but. We know that for many of us, the path to a diagnosis has been a bottleneck of dismissals, systemic barriers, and struggles, where sometimes symptoms are written off as not that serious. It's just acid reflux, maybe it's an ulcer, until it's almost too late. Now, today, we aren't doing a traditional interview. We're going to use a mirror format. This will be a reciprocal exchange where we treat the patients, the caregivers, the subject matter experts, all as equals in this storytelling. I have the pleasure of being joined by three incredible women, incredible Black women who have lived this fight. So I'd love to introduce them. And first, let's start off with Miss Kelle Brown, who is a survivor and active military member who has redefined life post gastrectomy. Kelle.
So, my name is Kelle Brown. I am a community advocate, a soldier, a mother, and a well caffeinated respiratory therapist, um, and a fighter. And this is, after my experience, this is something that I love to do. I love to advocate and be a part of this community.
Thank you so much, Kelle. It's a pleasure to have you here. You look gorgeous as usual. So glad to see you. Next, we have Anissa Bass, who is a widow that has been navigating the complexities of now raising her children who also carry the legacy of this disease. Anissa.
Hello, you all. Thank you so much for having me on your podcast. Um, I am a widow. I'm a mother to three daughters, and I'm a veteran, Army veteran, a nurse, and recently a cancer advocate. And I started a nonprofit for my husband, trying to get that, funded and off the ground. I really don't know what I'm doing, but I'm just glad that stomach cancer has a voice in the African American community. I was just speaking with my eye doctor about stomach cancer, and he agreed with me that stomach cancer is not represented enough in the African American community. So I'm very proud to be holding the torch for the nameless and the voiceless people um, that fought this fight and are continuing to fight this fight.
Thank you so much, Anissa. Thank you for carrying the torch. Thank you for continuing the legacy. And thank you for doing this and showing the community that we don't all have to know what we're doing. We just got to get it done. And last but certainly not least is Natalie Queen, who is a caregiver who has fought the battle to get genetic testing as well as prophylaxis to save her family. Natalie.
Hi, everyone. I'm Natalie Queen. I am a daughter, a sister, and a mother to one daughter. Um, I was a caregiver to my younger brother who passed from stomach cancer, and I carry CDH1, and my older brother does also. So I'm just here to continue to advocate and to continue to make sure that the Black community is more aware of stomach cancer or aware if they are not sure or don't know what it is. Thank you for having me.
Oh, it's a pleasure to have you. It's a pleasure to have all of you. And thank you for sharing briefly about your experiences that have brought you to this space today. Because what we're looking to do here in this episode, in this conversation, is really discuss how we can move from the individual trauma experiences that you all have shared to collective advocacy. And we want to dive deeper into this fight to be heard, into what the reality of living life without a stomach in the aftermath looks like, but most of all, what the health equity gaps that you all encountered in some way look like, and really see what it would take and what it would look like for us as a community to really close those gaps. So, Kelly, I want to start with you and Anissa. You have both felt the weight of a medical system that just doesn't always listen. And you have the stories to tell as part of that. So please, let's get into it.
Okay. Anissa, let me ask you a question. So, as a mother, raising daughters who may carry this genetic risk because of your husband, Anthony, how do you balance the mental and emotional heaviness of their future with the need of just letting them be young ladies, young adults, young teens?
Oh, thank you, Kelly. That's a very important question. It's not easy. It's very it's a very layered response. You know, children um sometimes like to shut things off. They don't like to really remember their dad as being sick. They like to remember him as being whole, as being, you know, their dad. So when I talk to them about my advocacy work and everything that I'm doing and I'm trying to do to start up his foundation, they shy away from it. They're not interested in it. They've only been to the Debbie Dreams Foundation twice, and they do not want to come back. I think it's more because it's just like taking the band-aid off of a wound that's healing. You know, for me being a nurse, um, I get to leave all of that at work. You know, when I deal with death and patients and COVID and everything, cancer and heart attacks, whatever I'm dealing with at work, I get to leave that there. But I don't get to leave this story, you know, this thing that happened with my husband. I don't get to leave it. It's with me every day. You know, I carry this, and my children are they're watching how I'm dealing with it as a mom, you know, and as a woman, as their mother, and they're not interested in testing. And I am trying my hardest to get my oldest, well, my middle one, she's 20. I'm trying my hardest to get her to go ahead and let's get this testing done because she's starting to have some gastrointestinal issues that are mimicking what my husband was dealing with, you know, early on when we were trying to find out exactly what it was. So it's very hard. There's more education, more things I need to be finding out so I can put it in their language so that they can get, you know, kids would rather just not even know, you know. They don't want to know.
Mhm. I completely understand that. I have two young adults as well, a 23-year-old daughter and a 26-year-old son. My daughter has been tested. So I do also carry the CDH1 gene. My daughter has been tested. She does not carry the gene. My son refuses to be tested. He says, well, if no one tells me I have anything, then I don't have anything. And that's the scariest thing to me because I watch him and I feel like I see symptoms of things that I had, things that my sister had, but he would just rather not know. And that I understand that fear as a mother, as a parent, that no, I really need you. And as a healthcare worker as well, I want you to get this checked out. But as it's very hard also to not cross the boundaries because they are now adults, right? And I can't make this appointment for you. I can't do this for you. I can tell you the pros and cons of this. I can tell you that in our family, a stomach ache is not just a stomach ache and express to you. I don't want to put my fear on you or anything like that, but I understand that, but these kids are different.
Yeah.
So my daughter is nosy, so she had to know. My son just doesn't, he doesn't care to know. And that
Bombs you.
almost in a way hurts me because I would hate for something later to come up. And I begged him this long to get tested to see.
Yes.
So I understand that. It's a difficult line to
Right,
tightrope on.
right.
And thank you both for sharing because that perspective is not something that I ever even considered with having young children who may have these concerns. And so I know that Anissa, you have questions for Kelly as well.
Yes. So, Kelly, you've maintained an incredibly active life post gastrectomy,
Hmm.
even with your military background. You're always smiling when I see you. I would ask, what is the hardest part of the physical transition to your new normal that people don't get to see on the outside?
I think the hardest part for me, especially in the Black community, in the Black community, being heavier, being thicker is that's praised, and you're healthy and you're looked at as good. It's not there's nothing negative about that. So in the army, being strong, being fit, being good, that's when you're looked at, and more favorably. So the weight loss, although people would say, "Oh, you're so fit, you look so good," that internally to me was killing me, that I was small. And it's gonna sound super vain, but like my butt went first. I didn't want to go nowhere. I didn't want to go anywhere. I'm only 5'2", but before this, I was a little thicker and I was okay with it. But as soon as I lost that weight, I was almost embarrassed. And my friends would be like, "No, come out." I didn't want to come out. I didn't want to go to work. I still had to portray this, at work, I still had to be this physically and mentally tough soldier and be taken seriously. I'm only 5'2". I'm only but so big. So I work with a lot of men. I work in a pretty rough field where being taken seriously as a smaller woman, it sounds crazy, but as a smaller Black woman, it's sometimes not a thing. So I really had to deal with that internally, but on the outside, I just like, thank you, thank you. I hated at first for people to comment on my weight. It really did something to me. It bothered me. Like I would cry about that. Like I would go home and I would cry about that. My friend, I ordered on Amazon, I ordered padded panties. I was trying to like, I wanted to be myself. This new normal was not cute to me. It was not attractive. I did not feel womanly. I didn't feel respected. And these things may have not been happening to me, but that's one of the things that was happening to me, like physically and mentally, that no one else saw. Everyone else saw, "Oh, you look good now, you're fit," but no one's ever made a rap song about a skinny girl with no butt. And that was my thing. And it really bothered me. That was really like, that was triggering to me. Or when someone would be like, "Oh my God, you lost so much weight." I would want to punch them in the face. And that
Wow.
would be the first thing that people said to me. "Oh my God, you're so small. You're so small." No adult wants to hear that.
Yeah.
And then when, at the time my kids were still in school, I looked the same as the high school kids. I was small, like the high school kids. Like these girls now have womanly bodies, and I did not have that. I did not have a womanly body at all. And with the CDH1 gene that also has to do with breast cancer, I've also had a double mastectomy. So at one time, I had no parts of a body. To me, I had no parts of a body that made me feel womanly or strong or beautiful. But
Right.
people would say, "Oh, you're beautiful. You're beautiful." I just didn't. I could, to this day, I can't tell you that I believe that I look beautiful because of how I know what I used to look like. And this is not it to me. And that's one of the things that people don't see, like the the mental effects of your whole body has changed, your whole life has changed. But on the outside, you have to be so normal. And I had to go to work every day like this strong, strong person, but I never got to grieve my missing body parts, my missing normal life, my sister that I lost. I didn't get to grieve those things. I had to pick up and keep going. I went to work 8 weeks after I had my surgery. I was back at work, working nights, doing what I had to do, taking care of my family. No one sees the internal of that. And something as small as, "Oh, you look so small now," was really tipping me over. That was really setting me off. And I just had to kind of you know, just take it. But that's one of the things that people don't see on the outside in your new normal that have a triggering effect on some of us, especially in the Black community, with everyone saying, because once you get small, "Oh, she must be on something. It's something." No, I was sick. I was
Yeah.
sick. But people always have something to say. Oh, what happened to your butt? Why you don't have this? Why you don't have? And I'm like, this is, and that would be the first thing that people said to me, not even realizing that that was so negative, but
Right.
it really like it would like stab me every time, and I was so uncomfortable. I was so uncomfortable going out. I didn't want to go anywhere. So
I can understand that. And I'm trying to absorb everything that you're saying, um, and have empathy with it because when I look at you, I see your aura. I'm not a man, of course, I'm not looking at your body, but I see a beautiful person. And when I saw you in New York and I saw you at Advocacy, you just radiate, such resilience, such
thank you.
strength, such you're radiating things that you don't know you're radiating. The physical is nothing. It doesn't mean anything. And anybody that has an ounce of humanity or an ounce of of a soul, they would know that. They would know that the real Kelle lies behind your fight and you're getting up every day and trying to put one foot in front of the next. I understand about your body. I mean, I'm a big woman that goes up and down in my weight as well, and but I'm not fighting it in the same avatar that you're in. I'm not in your body, so I can't speak to that. But as a woman, I want you to know from another woman, okay, that has a big behind. All right. Let me tell you something, sister. You are awesome. Okay.
Thank
You
you
are.
so much.
You are.
Thank
And your
you.
story matters. Everything that comes out of your mouth, even you getting on here today, after, having your surgery, I could just imagine, I just, it's like nobody can tell your story or nobody can really
Right.
talk to it but you. Nobody, you can't live what, or you can't understand what I felt holding my husband, me
Right.
watching him take his last breath. You'll never know that. And I don't ever want you to know that. When you
Yeah.
fall in love and get married and you with your husband, I want you to live forever. I don't want you to ever experience a death like that because you carry it every day and you see it in every patient and you wake up every morning and it repeats. So
Mhm.
I just want you to know the physical, whatever that is, that don't mean nothing. Long when we're all gone, your story will be what remains,
Okay.
not what you look like. Your story
Thank you.
and your beautiful spirit.
Thank you so much.
And Kelle, when you were talking about how you felt like with your body, like I go back to thinking about my brother when he was going through his journey. He didn't want any of his childhood friends, nobody to see him because he had lost so much weight.
My husband
My
too.
brother was 6'4", and worked out every
My
day.
husband too.
He's
Yeah.
a muscular guy. Yeah, Anissa. And then he lost all this weight. He lost everything. And he was like, no, they can't come see me. No, they can't come see me. I'm like, you grew up with them, sir. They don't care what you look like. They want to see you. I don't want to see them. I don't want them to see me like
Yeah.
this. And when you said that, that's when it just like, oh,
My
that
sister did not let anyone come to see her. So my
yeah,
sister had stomach cancer as well. She was alive for 52 days after diagnosis, after stage 4
yeah,
diagnosis that had metastasized. She would not allow, she did not tell anybody. The very first thing that she asked me when I first saw her after diagnosis was, I look skinny, right? I look skinny, right? And I was like, no, your head is still big. Because that was my sister. So I had to, I was like, your head is still very big. But she would not allow anyone to see her that way. And she didn't let me tell any of her friends until about maybe 18
yes,
hours before she passed away. So not only did I have to call her friends and tell them, hey, Carmen has cancer, she's also passing, like actively passing. And that I was mad at her for that. I was mad at her for that.
Yeah.
But she did not want anyone to see her that way. And I did not fully understand that until
yeah,
later.
Yeah.
But that was the first thing. I look small, right? I look skinny, right? Because my sister was thick too. She was a thicker girl. And that was the very first thing. And I hate that that's something that's in us like that to even think about. Not, oh, I'm sick and I'm dying. I want to see my friends before I go, but I look skinny, right? I don't want to go anywhere because I look like this. I don't want to go to work because I look like this. I don't want anyone to see me this way, frail in this way.
Yeah.
I hate that for us. I really do. But our community has made it to where it's a thing.
It is a thing.
Yeah.
It's a thing. So
I wanna
When they said, oh,
I wanna say two
when they
things.
said, oh, sorry, go
No,
ahead.
no, no. Um, I want to say a few things. One, Kelly, you fine as hell. Like, and
You
this is
better tell
me
her.
appreciating you as a Black woman. I have seen you over the years at different events, and for me, the confidence that you walk into rooms with is brings such a light who can't help but be attracted to you. And I'm not talking like romantic attraction. I'm talking just the attraction of one human being wanting to bask in the shade of the light that you emit is astronomical. Um, to the Black community, little booties deserve love too.
Yes,
little booties matter.
Little booties matter. And it
Mhm.
is important for us to acknowledge that. And I think that the conversation about how we look in our community is such an important one for us to continue having. As somebody who has an illness that made me gain weight, I gained 100 pounds in 1 year. I had to, and I'm from the islands, and I had to explain to the island aunties that you get fatty is not a greeting of hello.
Right.
Like, please do not. And you
Yeah.
would think that we would have learned from Chadwick Boseman's story
Mm-hmm.
how the critique of body image is damaging without knowing the full story of what a person is dealing with. But it has put your husband, your sister, and even yourself, Kelly, in spaces of not even wanting to reveal the true nature of your illness because of what the appearance look like and because of the fear of critiques and judgments. Like, why can't we just let people be? You know? And that's a hard one because you all, while dealing with these medical concerns, had to be catering to the emotional labor of what this person was dealing with in the change in their identity and appearance, and even for your own self. And both your families have struggled through this fight for even just a diagnosis, even just testing, with the younger ones where symptoms are oftentimes dismissed. It's not that serious. I want to ask you, how did you find the strength to keep pushing when there was a whole medical system telling you it ain't nothing, it ain't that serious, it's just a little acid reflux? How?
So I'll tell you, my sister was misdiagnosed and just turned away so many times that by the time someone did listen, it was stage 4 and she was only alive for 52 days. That's when I found out about the CDH1 gene mutation because my mother also had lobular breast cancer. I went to get tested, but I had to ask 4 times to be tested. 4 times. I was turned away 3 times before someone finally said, okay, I think we can do that. I think we can do that for you. Not because there was no genetic counselors there. It was nothing like that. I had to ask 4 times to even be tested. After that, I was getting sick. I was having a hard time holding my food down. I was having severe abdominal pain. I went to the ER and they told me it's in your head because your sister passed.
Yeah.
Wow.
In my head because my sister passed.
No, it's literally your gut, girl.
Like I said, no, I know what I feel like because I'm not, working in healthcare, sometimes we feel like we're invincible and I can fix everything at home. I'm good. It's not in my head. If I've gotten up and gone to the emergency room, something is wrong with me. Something is really wrong because I've waited to the last minute at this point. And that lady looked me in my face and said, it's in your head because your sister passed. Ah, I
Yeah.
could have been gone
Yeah.
because of people like that. If I did not have the strength, if I did not watch my sister pass, that would not have given. I got the strength from that. That was not going to happen to another one of Elizabeth and Kenneth's children at
Right.
all. I have children. I have children. And once I understood what this CDH1 was and how aggressive this stomach cancer is, I have children. I have no choice. You can do whatever you want to me, but you will never, ever, ever do anything to my child. So I have to stay here to protect my kids, to do something that's to make sure that we have better for them, for my grandchildren, for their kids. Because if my kids have this CDH1, which thank God my daughter doesn't, but if we've passed this down, I have to do what I have to do to take care of all of these children that come after me, that came from me.
Right.
Yeah.
We didn't know before me. We had no idea. So it stops here. I have no choice but to be strong enough to protect my family and other people's families, and for Black people to stop being turned away and dismissed when I tell you I'm in pain, when I tell you something's wrong, when I tell you this. I'm not telling you this for the fun of it. I did not come to the hospital for the fun of it. Please listen to what I'm saying.
Yes.
That in itself gives me the strength to continue to go. I'm tired of seeing this community be turned away for no reason whatsoever other than I'm a Black female. I'm a Black male.
Yeah.
And I'm dismissed because I there's no way I could be in that much pain because I can
Right.
endure, because I'm so resilient. Absolutely not. When she told me that, it's in your head, I wanted to tell her, go to hell.
You should have.
And
Absolutely valid.
and then after I was in the hospital one other time after I got my stomach removed, I had a doctor look me in my face and tell me, it is impossible for you to not have a stomach. I'm so sorry. What do you no, you have to have something. No, I have nothing. My esophagus is connected to my small intestine. That's what I have. I don't have, that's not possible.
Yeah.
A
How
doctor who went to
irritating.
medical school.
Yes.
Oh, okay.
How irritating is that?
Mhm.
How, and then so they're doing an ultrasound and they were like, nah, it's not nothing in there. Just gone. Yeah, it's gone. It's not that I'm telling you that it's gone. Where would I get that from?
Mm.
Why are you not listening to me? Why am I not worthy of your trust in my body?
Mm.
How is that? Because you read a book? You read
Yeah.
a book? I've read plenty of books. I'm a respiratory therapist. I got a whole Egan's book that's this thick that I go to work every day. I ain't never seen none of that stuff in that book before. Every trauma I go to, it's not in that book. Every person I encounter, it's not in that book. That book was a guideline.
Yep.
That book gave me an outline. That book gave me some normal values, what I can look for if something looks abnormal. That book did not tell me about if you come in with an asthma attack, if your daughter comes in with an asthma attack, if your mother comes in with COPD. That's case by case. I'm not about to tell you about you. You tell
Right.
me, and then let me see what I can do for you. You
Right.
don't get to tell me about me
So
because you read it in a book. I appreciate that you went to school. I appreciate, and I'm thank you for your knowledge and thank you for being here and your willingness to help. But you don't get to tell me about me, and you do not get to dismiss me
that's right.
because you've never heard of it or seen it before, and it's because it's never happened to you. I'm so sorry. That's just not how this is going to work.
That's exactly
I
right.
love this so much. I love it so much because as Black women, we are so often overlooked. We're so often disregarded. We are so often dismissed. Um, to have our voices be heard is such a struggle, and it shouldn't have to be. And as a clinician myself, I tell my clients all the time that nobody else is an expert in your own life except you. You're the one living it. Like I can empathize with your experiences. I can be understanding of your circumstances, but I don't know the muck that you are wading through because I'm not in that muck with you. And so shout out to you because it takes strength to have a voice amongst groups of people that would rather not listen to us.
Yeah. And it's so easy to just be like, okay, thank you,
Yeah.
and walk away.
They're
Yeah.
authority figures. So who am I to question authority, especially if you come from cultural backgrounds that have taught you not to question what doctors, lawyers, officers,
Right.
teachers, principals, like you come from this cultural background that tells you to hold your mouth, keep quiet, listen to what the authority figure tells you, and take it as truth and fact.
Yep.
While sitting in a body that is telling you that no, my truth and fact is different from what they're verbalizing, and I need them to know it. So thank you so much, Kelle. Just such powerful, powerful words, powerful language, powerful stories. Anissa, I would love to hear your perspective on these symptoms being dismissed and just finding that strength to keep pushing through.
Thank you, Aisha. Thank you, Kelle, for your words. Sitting in a caregiver position is quite different from being a patient. But one thing that I can add to that is there's two things that help me to understand my husband's pain. It was my 32 plus years as a nurse and also my military training, paying attention to what's ahead of me. There was instances where my husband would say that he wanted just orange juice, and they would come in with everything but orange juice, simple things. And I guess it was because maybe that felt, better to his bleeding ulcer. My husband presented with no symptoms. I want to say 6 months prior to us finding out that he had blood clots in his lungs and blood clots all throughout. He had, ongoing indigestion, heartburn, acid reflux, all those things. He came home. I would never forget it. It was Easter. Um, 2022, he was limping. And I noticed he was limping. And I said, what's going on with your leg? Why are you limping? And he said, I don't know. I guess it's my new boots. And me being the investigator that I am and watching over everybody in this house, I said, no, something else is going on with your leg. Your leg, you can't even walk. You couldn't even walk up the stairs. And so with my constant, nagging, I got him to go to the ER. They couldn't find anything. Well, that wasn't good enough for me. As a nurse, when I go in and I see a patient and they're sick or their temperature is up or they're vomiting or they can't breathe, whatever it is, it's my duty, you know, to find out what's going on. And just because the last nurse couldn't find it or the last doctor didn't listen, that doesn't mean the buck stops with me. It means that it's now my turn. So the baton is in my hand, you know what I mean? So I kept on him, and then finally, I got him while he was on the road traveling back to Tennessee, to stop, and catch his breath. And by the time he made it to Tennessee, he spent the night in the hotel. He didn't want to go to the ER because men are hard headed. But he went in and he had blood clots all throughout his lungs. And I got in my car along with my son-in-law, and we went, drove up to Tennessee, and they admitted him. And I'm telling you, they dismiss Black assertive women that are upset or angry or indifferent or question whatever you're bringing in here. For a long time, I didn't let anybody know I was a nurse. I never said I was a nurse. I didn't want to let you know that I knew how to read everything in his chart because I wanted to see how truthful you were going to be, with everything. And they lied. They gave me a cookie cutter diagnosis. They basically said, he has stage 4 or stage 3, now stage 4, some terminal stomach cancer. And he's gonna probably need hospice. And if it wasn't for me, knowing people that I know, before I met, everyone at DDF, I have a friend named Matthew Hammond who, got diagnosed and found his own doctor. He went to Florida and had his stomach removed. That's just like that. He found an African guy that would do it. And, that's exactly what he did. So it took me knowing that actually happened. Because just like Kelle said, a lot of people don't know that you can live without a stomach. They think that is ridiculous. They think that you're lying. They think that that's not information that's not being documented. It's in the NIH. It's in the Journal of Medicine. It's there. And so as I begin to talk about, what is it called? Where they do the gullet, where they make a gullet, they attach the esophagus to the small intestine. When I started talking about that procedure, they were looking at me like I was crazy, and I said, I know that you can do that, And so they said, okay, well, we'll look into that, we'll see. And I'm like, what do you mean? You'll see, this is my husband laying up here. He has excellent insurance. He's a government employee. And they just moved me along like that. They didn't want to give it a chance because it was too far gone. You understand? If it's too far gone, and me being a medical professional, and I know, and I've been on the side of billing, I know that there's not a lot of money, chasing a cure for the advanced stages of terminal illnesses. They really don't want to fool with that. So it took my voice, it took my advocacy, it took me advocating, preparing myself mentally as a caregiver. And now, I'm not a nurse because I'm not taking care of him, but I'm his mouthpiece because my husband was very stoic. He didn't complain. He didn't ask for pain medicine until he got to like 9. He didn't say one mumbling word except for, if this is, what my fate is, then this is what it is. He basically just accepted it, and see, he succumbed to it, but I didn't. I fought for his treatment. I fought for his 30 plus blood transfusions. I fought for radiation, and I fought for chemo. I did everything I knew. I even got online. I found Melanie, and I didn't know her from a bag of peanuts, but I found her. I found DDF. I found the stomach, gut, no stomach for I found everybody. I didn't even know y'all was out there, and I was holding on, and it took me, because my husband would not let me tell nobody. He wouldn't let me record, and I'm a very transparent individual, okay? And if I ever get sick, everybody gonna know it. I'm gonna tell everybody. You're gonna know about it. You're gonna know what you can do, the treatment, everything. My husband didn't want nobody to know he was sick. He didn't want anybody to know about nothing. So it's hard for me. I didn't have any answers, and my kids were just looking at me like with fear in their eyes. And I remember instinctively one day I was crying in the hospital with him, and he looked at me and he said, "Are you okay?" And I said, "Yeah." He said, "Well," he said, "because I'm really concerned about your mental." He said, "I need for you to get it together, because you're gonna have to, take this on home for me. You're gonna have to handle all of this." And that was just like, y'all, that was the biggest big girl, panties that I ever had to do, and I did it. And I am so proud, of his fight and the way that he fought cancer. He did. He wanted to live, and he did for 3 months. So I would say that continue to ask questions if you don't understand information that's being given to you. A lot of people can't read that stuff. There's a lot of things that they messed up during his surgery. There's a lot of things that they covered up that they didn't reveal to us. And if it wasn't for me understanding medical jargon, I would not have been able to ask pertinent questions. I would have missed the medicine they was giving him was inadequate. The diet that he was on was inadequate. Everything they was doing was feeding his cancer. It was not curing it. And if I had it to do all over again, um, I don't believe that he would have went the chemo route. I think that he would have just, I've taken care of patients that have cancer, stage 4. Okay. And they never let a doctor cut them ever. They just live with the symptoms. They're in pain, but they're still alive. You understand? So, I think for me, and him, I think that if we'd had just a little bit more time, we probably could have had a little bit more time to really investigate, because every case is different. Everybody presents differently. We didn't even get CDH1 testing. We didn't get nothing. They didn't want to test nothing. They just wanted to say he had differentiated cells. He had these markers, and he's got stomach cancer. Boom, hospice. He's gonna die. Take him home next. That's how they treated him, and they said it right in front of him. As soon as he woke up, they said it right in front of him. They said it just like that. And that's the reality for a lot of patients out here, and that's the reality for a lot of caregivers out here. It's you're hopeless,
Anissa, I want to, and I hate when people commend us for being strong, but I want to thank you for being strong and for continuing to do that, because you don't have to. You could have just sat down and said, I can't do this. But for even realizing how important it is for you to continue to fight with us and with caregivers and with patients and with everybody, and for your children, for our children, realizing how important that is for you to keep coming out, because that is hard to continue to tell that story over and over. Because I know, Natalie knows, we watched our siblings, it wasn't our spouse, but we watched our siblings go right in our face.
Yeah.
So I don't know what it is to lose a spouse, but I do know what it is to lose my sister 14 months apart in my face and be so helpless, and at that time have no answers. So for you to continue to come out and continue to tell his story, for us to be better as a community of not only Black people, but for Black people in the stomach cancer community, for us to be stronger, for this to be better for us, I thank you for that. Because it could have been like somebody could have been standing in my place telling my story right now. And I would wish for that, for someone to be as passionate as you are. And I thank you for that.
Agree. Absolutely agree. I don't want to be a strong Black woman no more. I hate it.
Get me
I'm
off
so
the list.
tired of
Get
it.
me off the list.
I
Get me off the
I didn't
list.
ask for this, and it's interesting because I've never really heard societally any other group of people be referred in that exact phrasing. It's always strong Black woman, you know? I don't hear about strong white woman. I don't hear about strong Asian woman. It's always the strong Black woman. And I just want to say this here in the year of our Lord 2026, in February, Black History Month, we tired. We're tired. I want
Exhausted.
we want softness. We want
Yeah.
gentleness.
Mhm.
We want relief.
Mhm.
But
All of that.
boy, oh boy, when you said you pulled that big girl panties up, I was like, been there, done that.
Yeah.
You did that, sis. And you did that on behalf of him, on behalf of your family, but on behalf of us as a whole in
Mhm.
so many ways. And I know he appreciated you because that's just such powerful stuff. You all talked about a lot of the considerations that we have in the Black community, in the Black space. So I think we can just shift the conversation towards what the advocacy has looked like so far, especially for your sister, for your husband, for your brothers, for your fights, and why, as a Black community, we have had to advocate so deeply. So I'll turn it over to Natalie.
Aisha, in your work with health equity, why do we see such a persistent trend of Black patients being dismissed with minor issues like reflux while their cancer progresses? Is it a lack of education or a deeper systemic bias?
Oh, and I think listening to Anissa and Kelly's stories, um, and knowing even your own story with your brother, these are all just experiences that have represented that trend of being dismissed, right? And there's so many parts of it. There's so many elements to it. But one of the things that we have to understand as a Black community is how entrenched the bias has been in how the medical field has even developed over the years. And when we look at the history of Black bodies and how we were used in the scientific and medical field, we were used as property to be experimented on, not treated as human beings with care and consideration, right? And there's so many different stories throughout history that you've seen time and time again. And one of the things that I want us to understand as a collective racial culture is we inherit the trauma of those stories even without ever having gone through those experiences ourselves. And the systems upon which this field has been based has been inherently biased in ways that is still representative of the type of treatment we receive, even if the individual provider, doctor, clinician themselves may not have any explicit biases, right? I've read textbooks, I've read medical textbooks that speak to the high tolerance of pain that Black women can feel, right? That inherently comes out of the history of Black female bodies being used as experimentation on reproductive and scientific and gastronomy. Like, this is all rooted in the history of our bodies being disregarded as things that have feelings,
Right.
or for brains not being whole enough in ways that can really have full comprehension. And if that's how people were taught in schools, even as a clinician, even as a Black female clinician,
Yes.
in my academic program, I was taught to look for symptoms of certain illnesses in Black men more than other people. I had a professor tell us that you're more likely to see Black men with this extreme pervasive disorder than anybody else. And I remember my question was, but why? Is there a genetic factor? Is it a social factor? And they're like, oh, because, it's just something Black people get.
Yeah.
And I was like, oh, okay. But when you're taught that, and again, you're taught this by authority figures that you're not supposed to question. When you get into the practice of doing the work, you will continue those behaviors of which you were taught, whether or not they are aligned with your personal beliefs, right? And this speaks to the greater systemic issue of how many providers are really engaged in cultural sensitivity and cultural understanding and cultural humility of knowing that there's things they really don't understand. And so treating people as individual stories instead of that one size fits all type of treatment doesn't really compute very well. But when we think about the dismissal of our pain, of our Black pain, right? We also have to take into account the cultural considerations amongst Black people with the mistrust in the medical field. And a lot of people are mistrustful for good reason, especially if you know the history.
Yes.
You telling me they did these to the in the Tuskegee trials, and now you want me to go in and do the same thing? Oh gosh, no.
Right.
So the mistrust is rooted in real and true circumstances, but that mistrust also keeps us from getting the help that we need when we need it. It limits us from seeking medical care. And culturally, we have all these alternative methods of treating stomach issues. In my culture, it's tea. Tea fixes everything. It don't matter what you sick with. You could break your leg. My mother is still gonna give you some tea to drink. Right? And I live in Florida, y'all. It is hot. I don't want to be drinking hot tea all the time. But that's the solution to the problem. I have friends who can tell you for any illness, for anything, you can tell them you have dandruff, and she has a herb for that, right?
Absolutely.
She has something that will fix it. And so we have become reliant on these alternative treatment options because of the mistrust in the scientific field, because of historically what has happened to us. But that oftentimes results in us delaying treatment for so long that by the time we go in there, we're now being told it's too late. We're treating things with Tums, we're treating things with teas, we're treating things with essential oils and ointments. And so we oftentimes wait until the circumstances become so detrimental. And then you're hearing from the providers, the clinicians, the doctors, why did you wait so long?
Yeah.
Furthering that mistrust in the relationship, because now I don't want to talk to you. We also come from backgrounds that have taught us to keep our private business private.
Yes.
You don't tell people what's going on outside this house.
Right.
I had an aunt that had cancer, a great aunt, grand aunt, that had cancer for 2 years and had not told anybody who lived in the same house that she lived in. And I was like, where y'all think she going every other day and every week? And why y'all think she wearing wigs? And I had all these questions about the people that were closest to her, and I questioned her. I was like, why haven't you told the people that live with you? And her statement was like, because they don't need to know my personal business. how can people give you care if they are unaware of what you're dealing with, of what is going on, right? And so there's so many barriers interpersonally, culturally, but systemically when we look at the dismissal rates of our symptomologies because we're just not taken seriously enough. That disallows us in getting the proper care that we need until it gets to a point where now we're being told there's nothing you can do, right? But I
Yes.
told you, I told you over and over. I come from a family with a history of cancer on both sides, and not just stomach cancer, every type of cancer. Somebody has died from some, I didn't even know Black people could get skin cancer until a family member did. And I was like, oh, I need to use sunscreen, right?
Yeah.
And I remember it wasn't until an advocacy day with TDF, my first ever one, that I found out about genetic testing from a family who had a history. And they were like, so you've never done it with the family you have? And I was like, no, nah, bruh. Came back home, went to my specialist and was like, somebody told me about this genetic testing so you can find out what I'm
Mhm.
likely to get.
Yeah.
And the doctor looked at me and was like, why haven't you told us to give you genetic testing before? Bruh, I don't know your job.
Right.
I don't know these things. I don't
How is that
naturally.
up to me?
How
Yeah.
is that up to
Yeah.
you? Know my
Well,
history. We have
I
sat
find
down. You have asked me who and who. I've told you grandmother, grandfather, grandaunt, cousin, this person, this person, this person. So knowing the pervasive predisposition that I have, why should it have been up to me to know what other steps to take to prevent my own self from developing the illnesses?
I've noticed, Aisha, I'm gonna add to that, to your point. I've noticed that uh, a lot of the responsibility is laying in the hands of the patient. They
Yes.
they really they really they really they really want you to self-educate and self-advocate for yourself. My eye doctor just told me, we were talking about a whole bunch of stuff, and he has nurses in his family. He told me that skin cancer was not was non-reportable. They don't want to hear about skin cancer.
Oh.
He told me that. And
Wow.
his wife and his family members, they sit on boards of nursing. Okay. So the information I was getting from him, he was an eye doctor, ophthalmologist, but he told me, he said, you know, they don't want to hear about it. They want you to take necessary action, even down to your own diet. We were talking about the food, the SAD diet. I call it the SAD diet. The standard American diet in the US is sad, y'all. I had the great pleasure of being able to. I went to Ghana 2 years ago, and when I went over there and I was asking for hot sauce and ranch dressing and ketchup and all kind of stuff, they looked at me and they said, we don't have that, ma'am. We have some. We can make you some, some type of pepper or some type of something to put on it, but here's a fresh salad to go with your fish, and your lobster. But we don't have, this stuff. And I realized over here, a lot of the food that we're eating, our food, the fortified food, all this stuff, everything, and I'll say it on record, it's crap.
Yeah.
It's killing us. And it's up to us. It's up to us. Even my oldest daughter, she took a stand. And my husband is not even her natural father. But my oldest child, she took a stand and she became a vegetarian when my husband passed. She said, that's it. I'm done, with meat and all of it. And so my children, we've removed a lot of things. We're not meat free 100%, but I've added more whole foods and I've added a lot of herbs. I follow Dr. Yaki. I don't know if you guys know who he is, but I follow him online. I follow all of his recommendations. Anytime I have anything going on in my family or my gut, or my children, we take a fast. We start a fast. That Daniel fast that they teach you in church. You start with that. Stop eating. Stop feeding the disease.
Then
Stop
the
feeding it.
burden is lying on us to prove these things or to ask for these things, but Yes, okay. But then when we're telling you, you're not listening to me. So there's got to be some sort of give and take there. There's got to be some sort of compromise. You're wanting me to ask for these things that I didn't even know existed. You're wanting
Right.
me to prove to you that something is wrong with me, but you won't do the testing. You're wanting
Right.
me to tell you how to do your job with me, but you don't listen to me about me. So where is the what
Where's it going?
Where's the
what do
proof
we
of
do
burden?
here?
Where's the proof of
Yeah.
burden?
And then
Exactly.
how are we supposed to how am I supposed to get anything accomplished if I give you all of this? You're telling me it's on me, and I'm giving you all of this, and you're still not listening to me.
You're still not listening to me. And I think I want to give Natalie that chance to talk about her advocacy, because it's been so important for us to have them, force them to listen. And Natalie, you had to watch one brother lose his life while you were fighting to get your second brother prophylactic gastrectomy to save his life. What did that battle teach you about how, as we've been talking about, we have to advocate differently in the Black community?
So my advocacy came from my younger brother while he was in the hospital before he was transferred to hospice. He had to advocate for himself because his doctor didn't listen to what he was saying. And so he made sure to have a meeting with all of his doctors and the patient advocate at Memorial Sloan to tell him to his face, you didn't listen to what I said. You didn't listen to my questions. You didn't listen to my symptoms. And he felt in his heart that that's why he passed when he did. Because had the doctor listened to his symptoms first and to how he was feeling, treatment could have changed for him. Would he
Yeah.
have still ended up passing? We don't know, but God took him when he did. And so by me being tested, my older brother getting tested, um, my older brother was like, after watching my younger brother pass, he was like, I can't do this for myself because his daughter was young at the time. She was younger. She's only 13, so she was younger at the time. And so it was a fight. Okay, what doctor can perform this surgery first safely without any too many complications? Um, and where are you going to have it done? Because at that point, we lost space in Memorial
Mm.
because of how they treated my brother. So where's this going to happen? And so we had to find a doctor who had trained with the doctor at Memorial who does this total gastrectomy regularly. And so we found one at Yale New Haven. Um, my brother met with him, talked to him, and he was like, "Okay, this is my journey. This is what I'm gonna do." It was hard because my brother still didn't trust that even if he had this total gastrectomy, that he would be okay. Is he okay to this day? He still has his reflux and he still has trouble swallowing sometime, and he gets his checkups, but it's like, bro, this shouldn't be happening still. What's going on? And the fight still continues, especially with him. For me, I just get surveilled every year because after watching him go through his issues after his gastrectomy, I'm just like, girlfriend not strong enough to do that. I got the strength, but I don't have it in me as much, especially after watching my brother every day. We saw my brother. I went to stay with my brother every day. He was in hospice in New York. I lived here in Connecticut every day. There's not a day that my brother was in hospice that he spent by himself.
Right.
Not an hour, not a minute. Some family member was with him. I saw him every day. If I didn't see him every day and I wasn't his health proxy, and having to tell the nurse that my brother said he doesn't want to live like this anymore. That day was the hardest day of my life. Telling the nurse, my brother doesn't want to live. What are you going to do? Because the
Yeah.
only thing that was keeping him alive was his IV fluid. Because when they told us that my brother was sick, the doctor told me that he looked like a Holocaust survivor. And that's how he looked. He was literally skin and bones when I saw him in Memorial ED. That's what he looked like. And fluids was the only thing that kept him alive. And so when he said no more fluids, I was like, bro, "You not gonna live." He was like, "I don't want to live. I'm not living a life right now. I'm laying in this hospital bed every day." He couldn't get up to use the bathroom. He didn't have the strength to take 2 steps. He couldn't feed himself. It was just like, okay, I get it. And that fight in itself was just like, okay, what am I gonna do different? Because my brother died so I could live. He died so my older brother could live. He
Yeah.
died so his 2 kids, son and daughter, can live, who have not been tested because they don't want to know either. Um, we're living. He passed. We're living. So I don't have any choice. So advocacy is part of my life now. It's all I have. And I do it for him.
Thank you. It's hard. It's hard to listen to these stories, to know that it took a loss for other people to be able to move forward, especially when we're considering how these standard clinical pathways have been inherently biased in ways that have impacted all your families, right? And we know that the statistics, we know the data, we know the numbers say that stomach cancer disproportionately affects us
Yes.
as a Black community. But these numbers should be a call to arms, not just in your individual stories, but community wise. Research has shown us that as Black people, we are twice as likely to be diagnosed with stomach cancer than our white counterparts. And in recent years, we have emerged as the racial group with the highest incident rates in the country. We're 14 per every 100,000. And even more disturbing and more troubling is that this disease, stomach cancer, represents the greatest disparity in cancer mortality rates between Black and white Americans. We look at the people in your lives that you have lost. We look at Kelle's survival. We look at the immense weight of all your losses. We think about the future of your next generation in all of these families, whether they want to be tested or not. And I am completely understanding of their choice to not. As somebody who has gotten a genetic screening, and I have siblings who are like, I don't want to know. I get it and I respect it. How? How do we not just bring stories like this together in this conversation where we are discussing the individual trauma that you all have gone through, and these heavy statistics? How do we push forward with moving this um, to really be a movement of collective advocacy that demands earlier screening, but also equitable care? And so, having listened to you all, I want you to tell us, in just based on your experiences, if self-advocacy was such a survival tool for you, what is one piece of advice you want to give a Black patient who feels that their doctor isn't listening? So,
Besides finding another doctor,
girl, this,
keep talking, because once you shut up, nobody's gonna listen. You have you are your own person. You have to keep talking. If you that doctor isn't listening, sorry, I have to find someone else who's gonna listen, because you're not helping me right now.
yeah, I
I
love
would have
that.
to say never quit. You know what your normal is, you know what your baseline is. They don't know you.
Yes.
And to be dismissive off of something they have no idea about, never quit. And I think we have to be more um, active in getting specifically into the Black communities when we're doing these healthcare fairs and things like that, to let people know it is okay to ask these questions and it is okay to ask for a second opinion. Like you said earlier, it's we were taught and brought up to respect authority, to respect people in, in these positions, but looking at what is happening to us, we have to know that it is also okay to advocate for yourself and not to stop until someone listens to you, until you are heard. They always say the squeaky wheel gets the oil, and it has nothing to do with being, aggressive or angry or anything like that. Do you want to live? Do you want to be here for your family? Do you want to be here for your children, your grandchildren? Then you cannot stop. It's uncomfortable, especially when you've been taught to be, just to say, okay, thank you. Yes, it's uncomfortable. And those are uncomfortable conversations that have to be had, but those are uncomfortable conversations that have to be had to save your life and the lives of your family members. So don't quit.
Absolutely. And Anissa?
I would say, make sure you document.
Mm.
Document. That's the first rule of nursing. In anything that you're doing. If it wasn't documented, it wasn't done. My daughter and I kept meticulous record, and they noticed it. They started putting it in his patient file. They started saying, "Oh, the nurse, the daughter and the wife, who's a nurse, they're documenting." Damn right,
Yes,
because
ma'am.
I'm preventing medication errors. You're bringing the wrong blood type in here. Yeah, I was all over them. I was all over them. Make sure you have a good foundation, somebody, caregiver, somebody that can uh, ask the questions, speak up, talk about what this test is for, what's this medicine for, why am I eating this food, you know, have a support system. If you don't have one, get online, join an advocacy group. There's so many of them. There was hundreds of groups, that helped me along my journey. And I'm thankful for that. So just make sure you document it, because at the end of it, they erase your file. They freeze your record, and you have to go to court to be able to get the file. Thank God I downloaded my husband's record, because they erased it.
Wow.
I do want to, can I add something to that? I do,
Absolutely.
like Anissa said, get a support system. I purposely, like, I chose to do all of this on my own. I didn't allow anyone to come with me. I didn't allow anyone to be in my space. I didn't allow anyone to help me. And that is probably one of the things that hindered me the most. I didn't understand why people were still upset that I didn't want to inconvenience them. But looking back, I needed someone there, because during those appointments, when they're telling you these things, sometimes depending on the information you're telling, you're zoned out. You
Yeah,
have cancer. I didn't hear shit you said after you just told
right.
me.
Exactly.
So now I'm stuck in here, and I can't even ask my questions because I don't know what to say. I don't know what to say. I don't know what to do. I'm thinking, okay, what do I do next? And you've talked for 15 minutes and I didn't hear anything. I needed somebody else there to catch the rest of that information and to ask the questions that I just completely zoned out about. I I but I didn't, and I was just like, thank you, and I left. And then 2 days later, I'm like, what did they
That's
say?
that
What
strong.
test do I need? What do I have?
That's that
And
strong
then,
woman.
look for the advocacy groups, but
Mhm.
do allow at least one person to
Mhm.
be there with you. Like you said, your aunt sat there for 2 years and didn't even tell anybody in the same house. Let somebody know, because you need that second set of eyes, that second set of ears, that other person, like you said, to document. There's going to be a space where you're going to just blank out, and you're not hearing anything because
Right.
you're thinking about all the things that you have to do by yourself. I chose that, and I will tell you that 0 stars. Do not recommend. I would never do that again. Um, and I didn't understand why that was so wrong, why people fussed at me about that, until later, when I've had to have more surgeries and more things and do more stuff, and how much easier it is to let someone in that space. But because I'm so guarded, it was very hard. But you have to let someone in that space. You need help in that to ask the questions and to advocate for you if they can.
I'm sorry. That one hit. Um, and that one hit really hard, as I'm the firstborn of a firstborn,
Right.
and the first niece,
Right.
and the first grandchild. And I look at my daughter, who is the firstborn and the first grandchild, and she's still pretty young, and I see these traits sometimes that reminds me of myself, and I worry, right? Um, But last week, my mother said, "Why are you so stubborn in having people help you?" And
That's
I was like, "I'm not being stubborn." But what I realize is that when you are so used to being the one that takes care of everybody else, it makes it difficult to accept that help. And you know, people love you, you know, people care about you, but this overarching sense of I don't want to be a burden
Yeah.
limits us so greatly. Because my mother made a statement when I told her, stop coming over the house. I can take care of myself, you know?
mm-hmm.
And she made this statement where she was like, I will worry more when I am apart from you about what you're dealing with on your own than if I'm just there to see it, right? And it's hard. It's a hard thing to let go of being the caregiver, the
Mm-hmm.
caretaker, the one in control, the leader, and to allow that vulnerability of accepting care. Because this is what limits us so much. And I want to say this, and this is purely my perspective. This is not the thoughts and feelings of Debbie's Dream Foundation or any other organization. It is purely Aisha's thoughts. Um, but Black people, the Black diaspora, it don't matter where the shit landed with your ancestors, we are a collective culture in
Yes.
so many ways.
Mm-hmm.
And I know it. I feel it every time I go out in public and see another Black person and we do that. And I love it. I love it when there's non-Black people around me and they're like, oh, you know them? No, it's just what we do in spaces to show that we are here and I see you and you see me, right?
Yeah.
And that is this shared identity that connects us no matter which parts you are from. But we have come and been brought to a country that is individualistic
Yeah.
in nature. And it's hard to be socialized in an individualistic culture to have to remind yourself of our collective agency.
Yes.
But it's so important that that collectivism still exists in how we show up for each other, but also how we allow others to show up for us. Now,
I'm sorry. So coming to Debbie's Dreams events, I and I hate when I get so excited when I see Black people
oh, me too.
because I don't want to see you in that space, right? But every
Yeah,
time I see somebody, I'm like, hey, and now you're my person because
yeah,
this is us together. But I hate meeting people there, but I love to see us there because we have to be because I can count on my hands the amount of us that are there. And for
Yeah.
us to be part of the most disparaged community, we are the least represented as well. And that bothers me so much. So I wish for more people to come because I know that we're out there. But Black people are so very this staying inside my house, but that's hurting us at this point.
Yes.
And we need the numbers, we need the people, we need our faces shown, we need to be unified in numbers and in volume, and so you can hear us. You're not hearing one or two of us, you're dismissing one or two of us, but you cannot dismiss all of us at the same time. But I just hate when I get excited, but I love to see us. I love to see us. And it just it does something to me, and I'm just like I'm happy, but I'm so sad at the same time.
yeah.
But I'm happy that at least someone came out. Somebody came out. And
Yes.
I just wanted to say that.
So I introduced myself, but I didn't introduce myself when we were doing introductions in the beginning. But again, I'm Aisha, and I am on the board of Debbie's Dream Foundation. And I had participated in Debbie's dream activities and advocacy day prior to being on the board. And I had also collaborated with them as a community partner on health equity programming and just initiatives. And one of the key things when I was a collaborator and a community partner was connecting DDF with Black-centric organizations in Black dominant communities, right? Because I knew the statistics and I wanted to make sure that instead of waiting for the people to come and find you, DDF went to the spaces where the people already were. That was like my And then I got a call one day and I got a question, hey, we would love to have you on the board. Yes, yes, I'm coming on that board. Um, a-
Right. Yeah.
Absolutely, because I work for an organization that's a funder and I collaborate with other community partners that are funders. And one of the key things that I look for when I'm reviewing nonprofit organizations for funding or for programming and initiatives is the board reflective of the community that you are serving?
Right.
Because you cannot understand the lived experiences of individuals only through empathy.
Mm-mm.
You can be as empathetic as you want to be, but you have not walked in the shoes of those people to truly understand what their realities are like. And so I question that a lot. And when I looked at the disparities of stomach cancer in the Black community, I wanted to make sure this was reflected in the individuals that are making the decisions for those communities. And so I joined the board of DDF, and it has been an absolute pleasure being there. So I brought my Latino husband in to Advocacy Day. I was like, "You're coming to DC too," and he was like, "To do what?" And I was like, "To talk about your brown people." Come talk about the
Absolutely.
brown people. The Black and brown people
Absolutely.
need representation
Mhm.
in if our voices are to be heard, right? And I agree with you, Kelly, which is why I was like, Kelly, you fine. I've been admiring you for years because I look for the Black faces in these spaces. And it's hard because I know that the stories that brought many of us there are so tragic in nature, right? And
Mhm.
I feel compelled to wish and hope that we don't have to be in need of this type of treatment and advocacy and services. But I still get excited when I see us because I'm like, yes, we in this.
Yeah.
We're fighting because we need people that look like us to do the fight for us, just as much as we need the allies, right?
Yeah.
So thank you.
Thank
Now,
you.
let's do a gut check. 5 questions, no prep, no filter. I just want you to say what is in your guts, physically or spiritual
I'll
guts.
do my best with mine.
Guts.
Yeah.
Spiritual. I'm trying to make sure it's applicable to all physical stages. And so to Kelly, what is one word you would use to describe your journey post gastrectomy?
I would have to say insightful. I've learned
Mm,
a lot about me. I've learned a lot about the people around me. I've learned a lot about the stomach cancer community. I've gained so much insight to who I am, to other people, to who other people are for me, and to who I am in the stomach cancer community as a whole. So insightful has been what I would say my post gastrectomy journey is.
I want you to know that my one word for you is inspirational.
Thank you.
You are absolutely inspirational. I don't know how you do all of what you do and still look so good doing it.
It's very carefully, very carefully. Thank you so much.
The first time I met you, I looked up your social media because I was like, I want to know more about this lady.
Aw, that means a lot to me. Thank you.
To Anissa, what gives you the most hope for your children's future right now?
I would say the word I keep leaning on is optimistic, optimism. Just like you guys say, letting somebody come in and help, letting someone help you to deal with, what's left. As you all know, I have a new beau, I have a boyfriend, and that has not been easy. Dating after 20 years, of a marriage. Me and my husband were married twice, We were starting our lives over on the second marriage. And just being optimistic for the future, and hoping that there's advanced technology, advanced testing, advanced medicine, in the event that my children have this gene and I'm gone, I'm not here anymore, you know, they would have a chance. So I would say optimistic is my word.
I like that. Thank you so much. And shout out to the new boo if you're watching this. Natalie, what is a myth that you want to bust about stomach cancer today?
Myth. What is that? Does it exist? Because people are like, stomach cancer, what's that? I've never heard of it before. And you can't live without a stomach. Yeah, you can. I know more than my brother now. I know a whole bunch of people now that live without a stomach. And stomach cancer does exist because I have lived that experience.
Think, listen, I remember my first DDF. I had just had gallbladder surgery, and I thought, this is the worst thing that has ever happened to me. I can't eat certain foods anymore. Oh my God, I can't drink coffee. And then I ended up in DC in a room full of people that were like, yeah, I don't have a stomach. And I was like, oh, okay. Like, okay, my gallbladder guy is in there like, okay, girl, and calm down.
I just had my gallbladder out on Friday. I'm
Oh,
struggling,
it's not
struggling.
fun. It is not fun, okay? But
Oh man. That, I will tell you, coming into like advocacy day, my first advocacy day was online because it was during COVID. But to walk into a room full of people like me, I've never been so 5 years old in my whole entire life. To look at other people and to know that they didn't have a stomach either, because every other space I've been the only one. But to look, I was so like, oh my God, and I'm looking at everybody else like, oh man. But it also gave me hope that, there's 20-year survivors and 18 years, 15 years. And at the time I was like early, like 2, 3 years maybe. And I was like, man, because I was like, I don't know what the survival rate of someone who doesn't have a stomach is, but to see everybody and they're just walking around and then to see everybody at the bar, I was like, yes, okay, I'm okay, friend. Like this is okay. I can do this. I am living. So it was it was so like that was so good to my heart because I had not seen anybody like me yet. I've only talked to people online, but to see them and to feel everybody is so loving and so like that was a thing to me because I was like, wow, look at y'all, look at how y'all looking. I like it in here, like this gives me hope for the future. So
Yeah.
yeah.
I went with a friend my first advocacy day, and it was I, I'm gonna be really, really shallow. The best part about it, that first time I went, not knowing much about DDF or stomach cancer, I was like, y'all got a lot of snacks.
Right.
Oh my gosh,
So many snacks.
so many snacks. And then somebody at my table explained why. And that's when like I was discovering the extremes of the disease. And I was like, oh, so the snacks are not for me. And they're like, no, eat. But like the camaraderie and shared experiences, no matter background, no matter race, no matter state that you came from, was just so impressive. I literally was like, I'm coming back next year. Like I'm coming back to this. It's been one of those spaces that like everybody just understood. So, and then Kelly, anything for me?
I think, let's see, what is one thing that you wish every Black stomach cancer patient knew before their first appointment? What would be helpful?
Natalie stole it earlier. Um, you can change doctors.
Absolutely.
Listen, I have had so many, as a psychotherapist, I have been the one dealing with individuals from a mental health perspective when they're going through chronic health conditions. And I have sat in rooms with clients who are discussing the dismissal that they've gotten for different issues, the disregard, the lack of treatment, the lack of care, the horrific bedside manner. And I remember the first time I had a client who just kept complaining about the same symptoms that doctors kept telling her was all in her head. And I was like, so change doctors.
Right.
And she was like, wait, what? And I was like, change your doctor. And she was like, wait, I can do that? I'm like, yeah, girl, you can do that. Like, if you go to a restaurant and you do not like the food, you do not go back to that restaurant and just put up with it because that's the only restaurant to feed you. You change restaurants, you speak to the manager, you say, I don't like this, you leave bad Yelp reviews. Like, we don't accept inequitable care from hairdressers, from nail technicians, from servers in restaurants, from hotels. And I'm gonna be honest with you all, as somebody in the field, the clinical field, some of these people suck.
Right.
Some of these doctors suck. Some of these nurses suck.
Okay.
Some of the therapists suck. They're human beings and they're flawed and they can read all the books, right? But that don't know they mean that they know how to apply it to real life. And
Right.
so I want people to know that self-advocacy is not just speaking up to be heard. Self-advocacy is also making different choices.
Can I
And
ask you
so,
another question?
absolutely.
As a clinician, what is something that you can offer or something that you can bring to the table to other clinicians to open their eyes to us being heard?
I think one of the most important things that I have tried to really fight for within the field because I moved away from direct service and I started doing more macro systemic work because I felt like, how can I reach more people all at once, right?
Mm.
And so one of the things that I segued into was doing professional development trainings and courses. And a lot of that came out of shared cultural trauma that I saw us experiencing as a Black community and symptoms being treated based on like individual pathology. This is why you are feeling this way. I'll share like personally, I remember when Chadwick Boseman died, the actor from cancer, and I said to a colleague where I was working, yo, it feels like I lost a cousin.
Yeah.
And the colleague looked at me and was like, it was just an actor. It's not that serious.
Oh, Lord.
Meanwhile, my Black girl group chat was like, bro, Black Panther? Like, oh,
Right.
our boy? Like,
Yeah.
we lost a cultural icon in a way that was personal to us that other people disregarded. And so I came over to this side and I started doing cultural and ethnic trauma trainings, cultural sensitivity trainings, cultural awareness trainings and workshops. Um, those have all not been offered recently in light of the
Right.
climate.
Mhm.
Um, but it was important for me to have people in the field understand that they needed to look beyond just the surface of who they were looking at. I was able to, and this was how I started collaborating with DDF. I was able to be a part of a statewide consortium of different medical partners and community partners where we created, developed, and implemented a health equity training program that is geared towards healthcare providers, teaching them how to bridge better care with patients of different backgrounds, ethnicities, and lived experiences. We've changed the name now. It is called Bridges to Better Care. But the whole premise of that program statewide has been how can we get medical providers to realize some of the systemic and inherent biases that are oftentimes subconsciously being given to the people sitting before them, and how can they better build those relationships and conversations in ways that sees people as all of their intersectionalities and not just a pathology on paper, right? And you know, I hope that for the Black individuals going into these first appointments, that when you feel the brush of that unconscious bias or even the microaggression that comes out sometimes, that you feel brave enough and safe enough to know that you don't have to take that.
Thank you.
Yeah.
Thank you.
Thank you.
So, in one sentence, everyone, as we get to the end of this illustrious conversation, which like I never wanted to end. I just want to talk to y'all. I want to sit down with a glass of wine, Kelly, and just have this be like our weekly meeting.
And we can.
Okay, all right, girl. Afterwards we'll talk. We'll follow up. But in one sentence, what would you say Debbie's Dream Foundation means to you in your fight?
Giving hope when I felt hopeless.
Oh,
I would say for me, Debbie's story, her friends and family continue to provide a safe space for other people to tell their loved one's story. So I would say that the spirit never dies. It lives on in each life that is shared, each story that is shared. We learn more about that patient. So that's what DDF has done for my family.
I think for me in the Army, there's some places where we have mottos, and one of the places they say always forward. And I think Debbie's dream for me is always forward. We're always moving forward, always fighting for something, always fighting for, bigger and better, and for the stomach cancer community to be heard. So always forward is what this community gives to me in my fight, that we're always moving forward.
I love this. I love all of this so much. Because I want to say this, it is so important to say their names, right? And to say the names of those that have become ancestors, to keep their stories alive. And Debbie's Dream Foundation gives the space and opportunity for that in so many ways. It keeps Debbie's stories alive. It gives you the space to share your personal stories, and it keeps the memories of those loved ones who died for what we hope is a reason, even if that reason looks like the prevention for others. And so this wasn't a part of this conversation, but since we brought it up, I'd like you to say their names. We've referred to them as their roles in your life, but please, can you share the names of these loved ones for which you continue to fight for? So, Kelly.
My sister, and the reason that I'm even able to still be here, her name is Carmen Michelle Brown. December 5th, 1979 to March 30th, 2016.
Thank you. Anissa.
Oh, my dearly departed husband, Anthony Leon Bass. February 17th, 1974 to August 10th, 2022.
Natalie.
And my younger brother, Christopher Allen Queen, October 1, 1971 to January 20th, 2019. My
Thank you.
peanut butter to my jelly.
And you have an older brother who you
Yeah.
continued to fight for, and he's still here with us.
My older brother, Richard Edward Queen Jr.
That's a name.
Yeah, ain't it though? I love Black people.
I love your last name, Queen. That's my maiden name. My maiden name is McQueen.
Oh,
Yeah.
And I'm just a queen every day of my life.
every day of your
Every
life.
day.
Every day.
Every day.
Listen, thank you. Thank you for sharing their stories. Thank you for sharing from your hearts. As we wrap up today's conversation, I want to thank you all, Kelly, Natalie, and Anissa, for your vulnerability. There's this meme, and I love it every time I see it, and I'm gonna just do it. Black woman. That's it. That's the meme. Because
That's it.
what needs to be said besides? We've gone through a conversation that has moved from the heavy physical realities of life without a stomach, um, the emotional weights of raising high-risk children, some of whom don't want to know their risk, and really the fight that all of you in some way have fought to just systemic battle for health equity and just being heard. And what we've done here, what this conversation has brought up for me here is proof that the story behind the stats is not just a collection of numbers. It's heart, it's wisdom, and it's courage for our community. We know that in the Black community, stomach cancer is not a rare disease. And we've seen that self-advocacy is our survival tool. So, for those of you who are watching, listening to us, partaking in this episode in any shape or form, I want you to know that whether you're fighting in the emergency room or you're deciding on surgery, you are not alone in this fight. There are women at this table, in this space, that have fought this fight already, are continuing to fight it every day, and are advocating on behalf of you. And we'll be in DC talking to the people who can make the decisions. And, that's always interesting to me because I was like, why I gotta tell y'all that cancer is important to keep funding and researching? It's cancer. It's bipartisan. Cancer don't care where you come from or who you are or what you voted. It happens.
Mhm.
And so at Debbie's Dream Foundation, the core objective is to move beyond just mere conversation and towards this movement of health equity. DDF has been dedicated since Debbie to curing stomach cancer. And that starts with what you have all brought here today. This raw, authentic storytelling that we shared at this table. And so I want to let anybody who has the ability just to take in this conversation that we've had know that if you or your loved one is navigating a diagnosis, if you're unsure of where to start or how to find those advocacy groups online, or if you just want to support this mission, please visit debbiesdream.org. There are resources. You can join our community, or you can help if you are in the scientific and medical field. We would love to have you contribute to this research that helps to change the future for the next generations. We're going to keep pushing. We're going to keep advocating. I already bought my blue sneakers, periwinkle sneakers. And I compel you all to keep sharing your story. So this has been From the Guts, and we'll see you next time.